Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Uses of ganglion blockers. There is presently no clinical relevance for ganglion blockers except in one, that is smoking cessation. For smoking cessation, we can use this ganglion blockers. So one, we have nicotine can be used as a transdermal or nasal spray, or they are used for chewing gums, and this has recently become available for the treatment of nicotine dependence, and this will aid in smoking cessation. Then second, we have varenicillin. Varenicillin is actually n subtype of nicotinic receptor which has a partial agonist. So this varenicillin is clinically approved for development for smoking cessation. Abstinence rates are seen after 1 year. They are higher in ratio when compared to placebo. So these are comparable to bupropion. Then we have third drug, which is bupropion. Bupropion is actually an NADA reuptake blocker. It is a reuptake inhibitor, so thus it is approved for smoking cessation. Then fourth, we have mecamylamine. Mecamylamine is used either alone or in combination with the nicotine patch. We can use either it has either alone or in combination with nicotine patch, and it has been tried for smoking cessation. It appears to block the reward pathway of nicotine and improve the abstinence rates compared to the placebo, and it is used in hypertensive emergency, and it is used due to aortic dissection. It is used in hypertensive emergency due to aortic dissection. We can use mecamylamine. Then we have trimethophan. Trimethophan is an ultra short acting ganglion blocker. It is an ultra short acting ganglion blocker which has occasionally used to produce controlled hypotension. It is used to produce controlled hypotension in aortic dissection surgeries. So we can trimethophan is an ultra short acting ganglion blocker which is occasionally used to produce hypotension in aortic dissection surgeries with or without esmolol. Trimethophan is used in the autonomic management of autonomic hyperreflexia. It is used in the management of autonomic hyperreflexia, or it is used in pulmonary edema. Then we have rimonabant. This rimonabant is a cannabinoid receptor 1 antagonist, and this is mainly tried as an anti-smoking drug, and it is also tried as an anti-obesity drug. And the main side effect of this rimonabant is it can cause suicidal tendencies are associated with this rimonabant.
thank you and thank you for watching.